Hey guys, this is Dr. Hunt at Hunt Physical Therapy. Today we're going to talk about some things you can do at home to treat something that's very common, and that's mid-back pain. The mid-back is also known as the thoracic spine, and I really love working with this population in the clinic because we see really good results, and it's usually something simple, something musculoskeletal that can be easily addressed. But today we're going to go over some things you can do at home for this common ailment. Again, mid-back pain. A lot of times people present to our clinic and they talk about a stabbing, burning, sharp pain kind of in the mid-back between the shoulder blade and the spine. But again, we're going to go over some things to do to help you knock that out at home. Okay, here we go. All right, so one of the best things you can invest in to treat your mid-back at home is one of these little 8-inch foam rolls. You can get these really cheap online, any place like Amazon. Sometimes I see something comparable at Target or Walmart for not a lot of money, but very useful for the mid-back. Going back to the reasons for a lot of mid-back pain is there's a lot of postural stress in our culture. You know, people that sit at computers all day long, and then they commute long distances. We sit at home and watch Netflix for hours a night, but that causes a lot of rounding in the mid-back like that, which causes a lot of compression on those thoracic joints, but also a lot of those muscles back there get stretched, they get damaged, and so they develop spasms, and that contributes to that sharp, stabbing, burning pain a lot of people report when we see them here in the clinic. But anyway, we're going to show you, like I said, some things to do at home. So we're going to start with this little foam roll, and I'm going to show you two of my favorite stretches for the mid-back. Okay, so the first one, take the foam roll and just kind of put it in the lower part of your mid-back to start. Okay, just like that. And then I like to cross my arms just to really open the rib joints back there. And then all you do is simply roll up and down. A lot of times you'll hear those little pops. We call that cavitation, when that joint opens up a little bit. Totally normal, and it usually feels good when that happens. And just do that for a few minutes each day. Okay, so the second stretch I like to do for the mid-back, also do with the foam roll. This one kind of gets a rotation component to the mid-back. It usually feels really good. So to stretch out the right side, what I'm going to do is I'm going to take my left hand and put it on the right side of the foam roll. And then I'm going to place my arm like this. Okay, I usually have my hand up, but from here you simply roll through. Like you're trying to turn to your left. Hold for a few moments, come back. Okay. To the other side, simply switch it out. Now we're going to roll to the right. I like to hold there for a few moments at the end, but it's kind of a repetitive stretch, and you can do that again a few moments each day. Okay, now let's show you some things you can do on the table, okay? All right, so at home I realize most people don't have a treatment table, but that's okay, because your bed will do, or even a couch, any kind of like level surface that's slightly elevated for these. One of them you can even do in a chair. But I'm gonna show you 3 things you can do at home that really targets the mid-back. Okay, so the first one we call opening the book. Lay on your side, and of course you're gonna wanna do both sides. I'm just gonna demonstrate with me going right to left, but at home, do both sides. Okay, so just kind of start with your arms out here like this. And then just like you're opening a book, rotate back like that as far as you can. You'll feel this stretch in your mid-back as well as your chest. Pause for a few moments. This is a good one to start out with in the clinic for people that may be too tight, or it's just not quite athletic enough for them to do the one that I showed you in the gym prior with the foam roll. But it's a good one to start with. Kind of targets the same area. Okay, so again, do both sides. Rotate back to the opposite side as far as you can. Hold for a few moments, and you can do this a few times a day. The next stretch you do, this is one you just kind of hold for about 30 seconds. Just lay kind of towards the edge of the table. I think it's useful to have your shoulders back a little bit, almost like you're forming this diagonal line with your body, and then hook your your left leg behind your right knee like that, and then just kind of rotate off the table like that, okay? If you want to make it a little more intense, you can let your leg drop off. I like this stretch because it gets the hips, gets the lumbar spine, and gets the mid back as well. So you kind of get 3 for 1. Like I said, I just hold this for a while, 30, 60 seconds, and again, do both sides. But start like this, and if you feel like that doesn't stretch enough, then you can let your leg drop off the side. Okay. All right. Another one you can do at home sitting with one of these big rubber balls that you can get really cheap at Walmart. It's just kind of a thoracic spine rollout. So just put your hands on top of the ball and then just roll forwards like that. Hopefully you can see what I'm doing here. But again, my hands are just on top of the ball and I'm just rolling forward like that. Head down, just to stretch out really the entire spinal column. Good for the mid back, but also good for the low back. We're going to do a series eventually on things to do at home. The two main sources of low back pain, I know this is a mid back video, but the two main sources that we see of low back pain are bulging disc and degeneration, which is a type of spinal arthritis. But you'll see some of the same exercises that we utilize for a multitude of different musculoskeletal things that we treat. They work really well for a number of things. But on this one, just 20, 30 reps once a day, and just roll out like that until you feel a good stretch. Okay, now we're gonna go over some exercise you can do with some really inexpensive rubber bands at home, and we'll be done. Okay, thanks. All right, guys, to wrap this up, I want to show you 3 of my favorite exercises that targets the mid back. It's not enough just to kind of loosen up the muscles of the joints. If we don't address one of the biggest sources, which is that rounded shoulder posture, with exercises that promote good alignment, it's just going to come back. So let me show you 3 things you can do at home with something really cheap. Again, I love these bands. You can get a whole pack on Amazon for around $20. They come in a variety of resistance, but I think this is medium, so I'm going to demonstrate the 3 exercises with that. So the first one is just a standing row, okay? Real important when you do this, you want to bring straight back, squeeze your shoulder blades together, chest should come out like that. I see a lot of people in the gym doing a row and it's all arms. And that's better than doing nothing, but doing it like this is way more effective. So again, shoulder blades together, chest out. I would do a lot of reps with all these exercises. So think 3 sets, 15, 20 reps. You could do these every day. But if you miss a day, that's okay too. So we've got that, okay? So standing row. And now I want to do a standing straight arm push down. So this gets the back as well, but it also gets the shoulders. But again, all these exercises are just going to promote us going from here to here, okay? So straight arm push down, arms stay straight on this. I tell my patients, kind of pretend that you're skiing and there's ski poles, okay? But the thing I mentioned prior about chest out, shoulder blades together, don't be afraid to pause for just a half second or so at the end of the contraction and do a lot of reps. Like I said, 3 sets, 15, 20 reps each day. The last one kind of hits a rotational component of the mid back. Move this angle so you can see me a little bit better. And again, at home, just wrap this around some bar, bedpost, just anything that feels secure. On this one right here, there's almost a rotational component, but you want to make sure that the shoulder blade goes back too. It's not just me turning like that, almost like you've got somebody behind you and you're trying to elbow them. So there is a turn, but also get that, we call it scapular retraction, that elbowing motion to really work those postural muscles back there. Same thing, 3 sets, 15, 20 reps. Each day. And as you get stronger, use the high resistance band. Okay guys, we appreciate it. If you enjoyed this video, like and subscribe. There's gonna be more coming, but those are some of the most effective ways that I found to treat mid back pain at home. Thank you very much.